Hello, darling. Hello, fam. Here are 8 tips for new nurses who are in orientation on their new job. Tip 1. Familiarize yourself with the interworkings of the hospital and the unit that you work on. Know where supplies are. If you don't have access to those supplies, then know who you need to contact in order to get them. Also, know where the lab is. Dialysis, imaging is very important because you want to be able to be more efficient whenever you're performing your duties from day to day. Tip 2. Ask all the questions and read. Whether it's a small question or a big question, make sure you ask. Also, read the policies and procedures that pertain to your hospital and the unit that you work on. You'll be glad you did. Tip 3. Hone in on those prioritization and time management skills during orientation because you're definitely going to need them working in an acute care setting as a bedside nurse because things are subject to change. You want to hone in on those skills now as you transition into independent practice. Tip 4. Introduce yourself to the team, whether that is the nurse practitioners, the physicians, the physical therapists, dialysis, dietary, and even housekeeping. You need to build these bonds at work. It's very important to have a face with a name so everybody knows who you are because you're going to need these people. Tip 5. Take the lead and ask for assistance from your preceptor as needed. It is very important that you take the lead on assignments when communicating the progress of the patient with the healthcare team or determining the plan of care. Whenever you're giving report or taking report, you have to learn these skills because it's very important in order to transition from a newbie to a more experienced nurse. Tip 6, take your dang breaks. It is very important that you get a sigh of relief. You get that moment of silence, some time to yourself when you are working these 12-hour shifts in acute care settings. Do not work the duration of the shift and not take a break. You need time to yourself when you're caring for other people because it can be quite challenging. Tip 7. As a new nurse, think about expanding your knowledge and getting certification and adding some more notches on that tool belt to make yourself more marketable. Whether you get a certification in PALS, Pediatric Advanced Life Support, ACLS, Advanced Cardiovascular Life Support, or CCRN, Critical Care Registered Nurse Certification. Tip 8, you are definitely not stupid. You are navigating through uncharted territory of nursing practice. Be confident in your ability to learn and grow. Happy new nursing.